Hi guys, I'm Hannah. Real quick, just wanted to let you know what we're doing today. So I'm going to give a brief introduction on kind of who I am, what is optometry, kind of the process of an annual exam, and then we're going to have a little trivia. We love trivia. And then of course my advice and questions are always welcome. Okay, so my name's Hannah. I am a first-year optometry student at UMSL. I actually start my second semester tomorrow. So after this, I'm headed to St. Louis. But I will be officially a doctor of optometry in 2027. So that's 4 years of school. And I go up to UMSL, which is in St. Louis. And that's my class. We have a smaller class size because UMSL is a smaller optometry school. But honestly, it's great, and we're all friends, so it's really nice. Like Mr. Hilly said, I graduated from here in 2021. I am currently engaged to Coach Reinhardt from the pole vaulting track team, if you know who that is. But we're getting married in July, and we've been together since high school.
Congratulations.
Thank you. Other than school, I love the outdoors and just, being active. I really enjoy baking, painting, playing the piano. I do love video games, and I love spending time with my family. And I am also a part-time photographer, just kind of as a way to pay for groceries and rent while I'm at school. Okay, so does anyone know what optometry is? Or want to take a stab at it? No guesses.
They're in the right place then. What a great opportunity to learn.
Yes, eyes. Optometry is all about the eyes. So basically the profession of optometry is just all about monitoring eye health for patients and like diagnosing, treating, and managing all of their diseases. So there's like a ton of different fields in optometry, which is pretty cool. And then I'm going to optometry school, so I am going to become an optometrist in 4 years. The other big one that kind of gets talked about a lot is ophthalmology, which is kind of more of the medical school route, and they do more like refractive, like surgeries and stuff like that. I'm pretty much only going to be doing like lens 1 or lens 2 kind of thing, and I'll send people out for surgeries. So, alright, so real quick, I'm just going to walk you through kind of what it's like to get an annual eye exam. Does anyone not had an eye exam or know what I'm talking about? Who has had an eye exam? Perfect! So this will be a review. But, it's cool to learn about stuff, and every place is a little different and might do stuff in different orders, so that's also something to keep in mind. So the first thing you do, you walk into the office, you're like, hi, I'm here for an eye appointment. And the secretary will get your information and have you sign some papers. Insurance, and then of course your demographics. And then once you sit in the waiting room for a little bit, they're finally like, okay, you can come back now. So the first thing we do is we ask a question. And that question is, what brings you in today? It's more of an open-ended question, and the patient's response is what we call our chief complaint. So, may I have a volunteer to be my patient?
Come on, somebody's
I'll pick
gonna
someone
have
that may be sitting over here.
I'll be your patient.
Perfect. Okay, you don't have to do anything. Cadence is going to be our patient.
All right.
So Cadence, what brings you in today? Are you having any problems with your vision?
No.
No. Do you have any blurriness or dryness? Nothing. Okay, well, let's say that she's having blurry
Her
vision.
contact prescription ran out.
Yes,
And it's only
contact
good for a
prescription
year.
ran
That's
out.
why she's back.
So basically, there we go. Basically, the patient response is what we call the chief complaint. And the setup of an exam is we have the chief complaint, we run these tests, and then we address and treat the chief complaint at the end of the exam. That's kind of how they set it up, and that's how everything gets cleared for like insurance and being able to get glasses, contacts, medications, anything like that. So this is kind of just a rundown of all of the information that we have to get, because contrary to popular belief, sometimes people don't think that like optometry is like a real doctor just because they see like a lot of private practices or like in these super nice places. But you know, everything matters, because a fun fact is the eye is actually the only organ you can look at directly, non-invasively, which is really cool. So it's important to get like all of this information, even like if you have had like, for example, diabetes or high cholesterol or MS, stuff that you would think is like, okay, why do I need to be telling my optometrist that? It's actually a big deal, because we can see that kind of stuff and we can even diagnose some of that stuff. So again, just running through this, ocular health, family health, we need to know if you're able, if like your family has a history of macular degeneration or glaucoma. We need to know that, because we can be like on the ball and ready to treat that in case we see early signs of that. Let's see. And then, of course, review of systems. If you've taken human anatomy, you kind of already know these things, but again, it's important to know everything that's going on with your body. Social history, making sure we know if our patients use any tobacco or consume any alcohol. And then it is very important to know if your patient knows where they're at, who they are, and when it is. Because if they're not, then we have to make sure, you know what, we're going to reschedule this. So, a lot of you may have known, may recognize a few of these things. I'm going to show some machines that are typically used in offices for pre-testing, which is basically how we just get some general information before we actually do the examination. So, how many of you just love the puff of air from after you look at the very cute balloon? I know everyone wants to raise their hands, wave them in the air, but basically that is what this machine is, and I promise you that puff of air is for a reason. But basically that hot air balloon is what we call an autorefractor. Basically, when we do a lens 1, lens 2, we're trying to figure out what your prescription is. So when you look at that hot air balloon, that is actually just measuring the distance inside your eye, so it gives us a baseline of what we can go off of, and sometimes we can actually end up using that if it's accurate. This machine with the puff of air, along with this machine, which is called a tonometer, these measure your eye pressures, and eye pressures are very, very, very important. The range is about 10 to 21 millimeters of mercury, and anything above this can be signs of ocular tension, which can lead to glaucoma, which is very, very bad and can cause you to go blind. So it's important to monitor that, and next time think about that when you have bad vibes for your puff of air. The other thing you might see, it kind of depends. More people who wear contacts mostly get this, but some people who are new patients get this as well. Basically, this is a topographer, and that is the one that has all of the rings that light up, and you like look straight dead center. What we're doing, it's kind of like, like sonar maps and like mountains, how they kind of measure the elevation. It's the same idea, it's just for that cornea, that front surface of your eye. So we use this a lot of times with like contact lens fittings, and if you have keratoconus, which is where instead of the like cornea is shaped like this, where it's more like a cone. So we have to monitor that and make sure contacts fit and feel good. Yes.
One of those a good one and one of those a bad one? Or are they just different?
They're just different.
Okay.
It kind of depends, but the other machine that we use is the Optomat, and I'm going to move over here. So basically, when we do the slit lamp examination, we look in the back of your eye. That's when you see like the bright flash. But this is taking a picture of the back of your eye, and it's just a lot easier because it can get up to 200 degrees range of the back of your eye. When we look with the slit lamp, we can only see like little bits and pieces, and we have to like put it together like a puzzle in our head to get an idea of what's going on. So this just gives us a bigger, broader view. This is a healthy retina, nothing going wrong. This is what you typically see. No, it is not actually green in real life. That is just the flash. This is a photoshopped image, but I think I really enjoy it because it shows you a lot of different things that the Optomap can pick up. So a lot of times when you see like those little black specks in your vision that look like dust, or like some people call them a string of pearls, those are floaters, and we can pick those up on the Optomap. We can also pick up retinal detachments. If you ever see a curtain falling in your vision, please go to a doctor immediately, because that can cause you to go blind. Lots of other stuff that can happen, but another one is we can also have cancer of the eye, so we can see that in there as well. Alright, another machine that probably you guys haven't experienced just because it is more geared towards people who suffer from macular degeneration or glaucoma or optic nerve tension. This is called our OCT machine, and basically it takes an ultrasound of the retina, and the retina is only 10 layers thick, and in reality that's about as thick as a sheet of paper. So we're able to break this down, and it's cool enough that you can scroll through each layer and kind of see that. So this is a healthy macula. That's kind of your 20/20 spot of your vision. And this is kind of just a baseline. This is your optic nerve, and that's kind of where your nerve exits your eye and where your blood vessels also enter and exit. With this machine, we can also get a 3D rendition of your retina, which is really cool and kind of just helps, again, with stuff that doesn't get picked up on other machines. And this is kind of that report that we see. And these lines over here, it's kind of what you would think. Green is good, yellow not so great, red not good at all. And all of these are based on the patient's age, which is also really cool. So, any questions so far?
So I'm looking here on where my arrow is.
Yes.
So that's the macula right there?
Yes, well that dip right there is the fovea, which is the center of your macula.
Yeah.
But everything else is also macula too.
Gotcha.
So.
Okay.
Yep. Ready. Another machine that we have is the visual field machine, and this is a more recent one because the old one was very annoying. If you had a patient that had a visual field, they would go to this big old clunk of 1980s plastic. I'm sorry, Mr. Elliott. 1980s big old thing of plastic, and they would have to rest their chin perfectly on this thing, and you would put these little lenses that look like a monocle in the machine, and then they have to sit there in a dark room and just click, click, and it was last almost 2 hours you were in the room, and it was just okay, let's go. So they came out with new technology, and I'm very glad because it's a lot quicker now and it's a lot more comfortable. But basically what you do in this test is there is a dot in the center, and you have the patient look right at the dot, and then any time they see a flash of light in your periphery, you just have to click the clicker. And basically what these reports are telling us is if they have any visual field loss. So on this patient, they have a little bit of visual field loss right here and down here. Anything that is lighter is fine. They can see that. This patient is actually suffering from a optic chiasm tumor. So it's causing this temporal vision loss. So it's actually kind of interesting to see that and how perfectly it follows the lines, which is also pretty cool. Alright, so once you do all your pre-testing, you head back into the room, and then this is probably when they start asking you questions about medical history, family history. But then you'll check visual acuity. So there's a few charts that we do. Most of you are probably familiar with the Snellen chart, which is just reading the letters all the way down. For kids that we test that are able to talk, we sometimes do pictures or the tumbling E. So obviously for this one, they'll tell us what they see. And for this one, they'll just tell us what direction the E is pointing. So it's just kind of helpful. For a lot of our low vision, older patients, we use what is called a Feinblum chart. And basically, it kind of is sad, but it's this giant poster board that just has like giant letters on it, and you literally stand like 8 feet from them. And you're like, okay, what do you see? And sometimes they can't see it, and you know, it's just like, you know, whatever. But
in those cases, does like glasses or anything help them, or?
Mostly it's more of like a pathological thing where they can have glasses, but like severe macular degeneration or glaucoma where it's just like you just have to keep monitoring and make sure it doesn't get any worse. So
There's really not much hope for macular degeneration.
Yeah, it's really unfortunate. But a lot of the times people will hear like the 20/20 vision, which is like the visual acuity measurement. So just so you know, the first letter of 20/20, I'll use 20/30 instead. 20 is your testing distance. So in the room, when you're sitting in the chair, that you are 10 feet away from the mirror, and then the mirror is 10 feet away from the letters, so that is 20 feet that your testing distance. Then the second number is, I said 30, so that's the line that you read. So this one, obviously I can't see it, but let's say it was like 2200. So I would test the person at 20 feet, and they were able to see the H, so I would give them 2200, if that makes sense. Any questions on this? Okay, cool. All right, so a lot of the times on like new patients, we'll do entrance testing, and this is a lot of just extra tests that we run on people. Is anyone in here colorblind and cannot see that circle? No. Okay. So, for example, if someone was colorblind, they wouldn't, depending on what type of colorblind they are, they wouldn't be able to see the number 12 in this circle. They would just see just plain, like it's just a regular circle with dots. Some other tests we do is stereopsis. This is where you put on this set of glasses and everything on the page, like a three-dimensional shape will come out. And this is testing like your depth perception. So it's pretty cool actually, and very interesting. The other pictures I have is, this is Engel-Hirschberg, and these are abductions. How many of you remember when like they take that light and they like draw the H and you have them like keep your head still but follow with your eyes? Yes. So that's testing versions, which is both eyes. And then just one eye, if we had you cover one, that's abductions. So we're just making sure that your muscles work correctly how they should. This one is making sure you don't have an eye turn, so obviously that is good. And then the more it gets like off-centered and doesn't match, you can pick up an eye turn. So we can actually get a lot of information from these entrance tests and the pre-testing stuff before we actually do the exam. All right, so refraction, the very famous lens 1 or lens 2. So basically, we just I'll kind of explain this later, but we just move the lenses until you can see that everything's clear. Something interesting, I don't have my equipment because it's in St. Louis, but we do have these prism sets, and there's also prisms in here, but it's kind of cool to see the prism bars. Basically, if someone has an eye turn that is fixable, like a small eye turn, we can put in a prism. And if anyone has ever looked at a prism, depending on the power, it kind of like turns. Like something that would be straight in front of you, if you put up the prism, it would like go over here. So we can do that for people who have eye turns, which is pretty cool. Alright, and then we have the slit lamp examination. So during this examination, we have the anterior portion, which is going over just this much, and then the posterior portion, which is going over your whole retina as well as the vitreous, which is that like gel that fills your eyeball. So this is kind of what you would see if you were on the doctor end of the anterior and all the things you would look at. So making sure everything's clean, your conjunctiva is white, that there's no like proteins or cells in there. And then when you do the posterior, this is what you would see. This is the color you would see, again, not green. And just make sure everything's looking good. So over here, you typically see this, but in small children or older people, especially when you're visiting nursing homes, you might see this, which is called a BIO headset. Basically, this is just like this, just on your face, and you use a bigger version of the lens so they can kind of focus that light and see it. So, pretty cool. And then finally, we have the assessment and plan. So we put in all these codes for the diagnoses and explain what we're going to do. So, for example, when Cadence had her blurry vision and we found out, oh, her prescription did change, then our code would be for, let's say that she is nearsighted, so it would be for myopia. And then our plan would be update glasses prescription or update contact prescription or something like that. Some other things, if it was like more dry eye or something like that, we might say like recommend Sustain or eye drops like twice a day for like 10 days. Sometimes for macular degeneration, we have them look at what is called an Amsler grid. And basically, you would see the normal like up and down straight, everything's straight. But if you had macular degeneration, this would become warped and become looking like squiggly. So a lot of the times if you talk to someone who has macular degeneration, they might say that things look wavy or something like that. So this is a way that we kind of monitor this without like having to bring them in like every week or so if it's getting like super aggressive. Okay, trivia. True or false, you have a blind spot in your vision. Anyone can shout it out, raise your hand. Yes, true. Yes, it is true. Oh, there we go. So, basically, we have rods and cones in our retina, which is the back of your eye, that kind of take light and turn it into information. So that's how we see. And in that spot that I showed you, that was like that dark circle, the optic nerve, that's where it exits, and our blood vessels enter and exit, and there are no rods and cones on that, so that's why you have a blind spot. But our brains are super duper smart, so they kind of fill this in, and it just kind of looks normal. The same thing goes for like eyelashes and like your nose. Like our brain is just able to like forget about it. So again, if you've had Mr. Helly, you've probably done this. This is to test your blind spot, where you can like cover your eye.
Let's do it.
Okay. It's a little low on the screen,
It
but
might work.
okay.
We should, you want to walk them through it, or?
You can.
Okay. Let's see if it works, because if it's that low, it may
Yeah.
not. There it goes, right there. Yeah, it does work. It works. And it's back. Okay, I just completely abstracted. Hey, everybody at home. I'm filming this. If you guys want to try it, come on, everybody stand up. Let's go. Come on, everybody get embarrassed at the same time. Okay. All right, for this to work, okay, you have to cover your left eye. Come down this row here. Cover your left eye, and you're going to focus on that plus. You have to really focus on it. When you get to right about here, that dot is going to go away, and it'll come back right at, well, shoot, it's still going. Oh, there. Yeah, so focus, cover your left eye, focus on that plus. You have to really focus on it. And when you get to about right there, that dot's going to disappear from your field of vision. And your brain is going to fill it in with white, because your brain is basically just guessing, because it doesn't know what's in that hole. And so it's like, well, everything else around it's white, so probably white. And so, yeah.
Oh, I was supposed to see the Yeah, look at the plus.
That might be
Get stabbed by the crash there.
Another cool thing is that I don't have any pictures of it in my slides, but if you've ever seen a thing where like it's the inverted colors and you're like supposed to stare at it for like a certain amount of time, and then you switch over and it's like a beautiful landscape that's perfectly colored. That's just your cones and rods being saturated with the color.
Do you want me to pull one up?
Yeah, we can at the end.
Okay, all right, yeah, I don't need that. Go ahead.
Okay. Second question is another true or false. This time you have to raise your hand if you think it's true. So, certain types of refractive error can get better if you look through a pinhole, and that is a pinhole. So, how many of you think this is true? Okay. Perfect. Slowly hands. Okay. How many of you think it's false? Okay, the math is not adding up, but
That's the problem. See, nobody votes in America.
okay, so yes, it is true. So pinhole occluders, which looks like this, or they have like multiple dots, they can be used on patients with astigmatism and myopia or nearsightedness without their glasses, so they can see smaller letters than they could originally see. And what's really cool about this is if a patient comes in and we do a pinhole on them without their glasses on and they come down letters, we know that their problem can be fixed with just glasses or contacts. But if it doesn't change, that means that something else in the back of the eye or like something with the lens is going on. So that helps a lot. Another fun fact is my optics professor was explaining that it was like Ronald Reagan, I think, when he went into, it was one of the presidents, but when he was going into the military, you have to get an eye test, and he was severely nearsighted, and so like they had the visual acuity chart on the wall, and they would be like, okay, cover your eye, and when he did, he would like split his hand to make like a DIY pinhole, and he would read with the other, like the covered eye that he could really see, to basically do this. So, you can also make your own and just like poke holes. It's pretty cool if you have this, obviously. If you don't, it's like whatever. So, but I did get tested with mine because I am very nearsighted, and I came down like, I think it was like 7 lines on the eye chart. So it's pretty cool. Okay, question 3. So another true or false, raising hands is great. In order to read up close, the lens in your eye, which is this part, gets stretched and becomes thinner. True or false? Raise your hand if it's true. Okay, and false? Okay. So you guys were right, it is false. So your lens in your eye actually becomes thicker, and this is what we call the process of accommodation. So it's really cool. And I won't spoil anything because there's another question about this. So when people get older and can't see or read things up close, it's because that muscle that holds the lens is becoming weaker. True or false? Raise your hand if you think it's true. Okay, and false. Right. So this is actually a common misconception. It's actually false. So over time, your lens right here becomes more stiff, and it just can't like stretch or get smaller or anything like that. So the muscles are completely fine, but your lens is just getting old. So this causes that weakened accommodation, so people can't see up close. That's why you see like a lot of people start doing the thing like this, or you get the readers, or some people call them cheaters. Yeah, Mom's shaking her hand in the back. All right.
I just started like within the last 6 months.
Yep.
There they are.
There
they are.
Yeah. And then one more thing about that last one, cataracts. A lot of people talk about cataracts. That's also another age-related thing. That's with the lens as well, and that's when all those like proteins and everything start to break down, and it causes that cloudiness that people see or yellowing. So that's often treated with cataract surgery because there's nothing you can really do like to take or anything. Okay, last question. What word describes when someone has blurred vision at a distance but can still see things up close? This is multiple choice. So, we have emetropia, myopia, presbyopia, amblyopia, hyperopia. These are all real words. Okay, how many people think it's A? How many people? It's B. Okay, C? D. And E? Alrighty. So it is B, which is myopia. And kind of explaining what all of these things are. So, we also know this is nearsightedness. Hyperopia is farsightedness if you are farsighted. And then if you have 20/20 vision, you're what we call an emetrope, so you have emetropia. So basically, in someone who has emetropia, they just, when light comes and hits the retina, it hits perfectly on the back of their eye. So they see everything perfectly clear. In someone who has myopia, I have myopia, which is like negative prescription. The light is actually focusing in front of the retina, and then it kind of disperses again, so it's like all blurred once it hits the retina. So that's why things get blurry. And the more forward this is, the more distance is blurry. So when I'm not wearing my contacts, I have to hold like anything I'm rating about right here. Someone who is, I'm at like a -4 and a -6. And that's just my powers. And someone like Cadence, who is having blurry vision, maybe she just has a -1 or a -2. She would be able to see maybe still be clear up here, and it would get blurry like about at the like thermostat. So it just kind of depends on what power. So that's pretty cool. For hyperopia, that farsightedness, it's the opposite effect. So the light actually would focus behind here, so it never focuses at first. So does that kind of make sense? Yes. Any questions so far? Cool. Okay. All right, switching gears. Just kind of my advice going into high school, undergrad, and graduate school. I knew what I wanted to do since I was in 7th grade, and I kind of was like, okay, this is what I'm doing. We're done with this. I started wearing contacts and glasses when I was in 2nd grade, so I just was kind of like, oh, this is pretty cool. You know, I've always thought about the health field, and then I just, you know, kept going to more and more visits, and I was like, oh, maybe I'll shadow, and then, you know, here I am in optometry school, going to be an eye doctor. So, my experience is a little different just because I knew what I wanted to do from the get-go, but still this is applicable to anyone wherever they may be in their decision processes. So in high school, I would recommend take classes you enjoy, but also be proactive. And that kind of goes in hand with my second one, which is like research your school of interest and what they accept, depending on dual credit and AP tests, obviously. If you have it narrowed down to a few, it'll get a little like, it'll fluctuate a little bit. But luckily, I UMSL's in the Missouri, University of Missouri system, and it was in the same state that I did all my high school stuff through, so all my dual credit and everything just like went through. So I got really lucky. I know someone who went to Florida who did not get so lucky with some of their credits. So the other thing, this is kind of a bigger thing, friends are great, but don't regret their influence. A lot of the times, a lot of people are like, oh, you know, I'm going to Ole Miss, or I'm going to Missouri State. Let's go to Missouri State and Ole Miss together. And, you know, it ends up kind of hurting you in the long run if you know that maybe they don't offer that program for you. So just kind of like look at the table, kind of narrow your thoughts down in high school. This is kind of where it gets like, okay, let's pinpoint what we're going to do. And obviously, again, everyone's situation is different. So, the biggest thing I can say is enjoy learning and have a good attitude. You're going to take a lot of random classes that are like all of these just random credits that you just have to have for your major. So like, one of my favorite classes was like a macrobiology. So like I learned about the evolution of the earth. What does that have to do with eyes? Great question. Will I be explaining the earth's crust to my patients? No. So it's just funny because just find joy in the journey, I guess. And then grades and adventures can coexist. I started doing photography when I was in undergrad, and that kind of took off, and now I'm doing that just a little bit in my graduate school, so that's pretty fun. Just making sure you're on top of your time management. And then understanding your professor's teaching style is half the battle. You'll run into a lot of people that have accents, or only do remote, or only like do things a certain way. And once you figure out kind of how they do things, and you kind of just are like, okay, well that's not how I do things, but I'll do it this way, you're fine. And then finally, graduate school. I was in 19 credit hours last semester. I'm in 20 this semester. So it's definitely tough. It's a lot, but obviously having a positive outlook is great. So everyone has different learning styles, but do what works best for you. Some people work great in groups, some people work great by themselves. Obviously, like, you can figure out that's what works best for you, but kind of just stick to your role. You've had all of this that you've kind of figured out your jam, just kind of keep rolling with it. Don't try and change it now when like you're doing all the important stuff. Funny and weird acronyms and sayings help things stick. So yes, we just finished the cardiovascular unit in optometry school. And every time I was figuring out all of these things and labeling all these things, I was still going, okay, arteries away from the heart, veins the back to the heart. So I'm telling you, it's the weird things that stick. And honestly, if you're in a profession that has to do boards, like optometry and like pretty much every medical field, this is like a big thing. Like, my anatomy professor is literally like a Mr. Helly on steroids. And she's just like, I mean, she made a whole story about the mafia, explaining like platelet plug formation of like a clot in a scab. Like, it was just,
I would love to hear that.
it was crazy. And like, we do plays. We literally act out like drugs and stuff in school. So, you know, having fun with that, it sticks, I promise. Again, school is tough, so remember to be nice to yourself. Make sure to take breaks, drink water, and eat food. There are many people in my class who think that Celsius is the only thing they should put into their body when it comes to midterms. Please do not do that. I feel like they should be in the hospital, but luckily they're still with us. And then I personally highly recommend intramural sports, or finding something with classmates outside of class where you can kind of just bond and just kind of chill out. And it kind of just helps, again, with your experience and just making friends. So, okay. Any questions? Anything at all? School, high school, optometry, anything?
Ask stuff, don't be shy.
I'm serious. Yes.
How many hours do you recommend to be on your phone every day? Like, or do you limit yourself to be on your phone every day?
I'm really bad. Between school, because I take notes on my iPad, so I'm doing all of that work. And then I will watch videos on my computer for like lectures in class. And then when I'm done with work and homework, I will edit pictures for my part-time job, which happens to be on the computer. So I spend a lot of time on electronics, and you know, we're actually seeing what we call a myopia epidemic, because so many things are moving to like technology and like iPads and computers. Like, more and more people are becoming myopic and nearsighted. So I don't limit myself, and I know that's not good, but just remembering to take breaks in between is great. Just like allowing yourself to like look in the distance, just like look at the windows, or look at the birds or something. I don't know. Yes.
Earlier, me and Mr. Heller were talking because he had told me that you were coming, and he also told me that you graduated in 2021.
Yes.
How many dual credit hours did you have to get through your undergraduate that quickly?
Okay, so I went to UMSL for undergrad because they had a program for their 3+4, which is a pre-optometry program, and into the optometry school. I wasn't immediately, when I enrolled graduate for like freshman year that I was gonna get into optometry school. It was just like, we do offer this kind of thing. So I am kind of like a little bit of an exception because of all of my dual credit, it all transferred. So I actually went in with like a semester and a half or something of credits. So I was able to do my full first year of school. Then in my second year, the spring, which was last year, I did my OAT, which was my like admissions test into optometry school in March. Not even a week later, I had my my interview with the College of Optometry, and then a week later, I found out I got in. So it was a roller coaster and a lot, but I was like, I went into school like, I want to do this in as little years as possible, and I know I can handle that workload. Granted, like my freshman year, we went to Disney, and I was taking a bioethics class while we were at Disney, and after we would come home from the parks, I would be reading and like literally holding my eyelids open over my winter break. So, you know, it came with a cost and all that kind of stuff, but we're here, so it's really whatever you feel comfortable doing with. So, yes.
I have a true or false question for you.
Okay.
True or false, you are slated to be the youngest optometrist in the state of Missouri.
True, that is true. When I graduate, I will be 24, and I will be the youngest practicing optometrist in the state of Missouri. So,
That's cool.
yes.
I also have another question.
Yeah.
Where do you want to practice optometry? Would you rather go somewhere closer to home or here? Do you have a job already lined up or?
So, because I knew I was going to, like, optometry was my route, I actually started doing my, like, internships and shadowing my junior year of, the summer into my junior year of high school. So I went, interviewed, I interned at Lead Eye Care, and I have been there ever since, and I love it, and I would like to work there, but we'll see where the cards lay out. I am gonna stay here though, so.
Greg or Jake?
Jake. Greg, he retired in 2020, I think.
Oh, wow.
Yeah,
That's a good year for optometrists to retire, right?
yeah,
2020?
yeah.
Sorry.
That year, that summer,
That's awesome.
it was so crazy. I was literally just like standing at the desk and I was just taking people's temperatures. So, I mean, like I wasn't even doing anything eye related, but I was just like immersing myself into the field that I wanted to work at. And if it was a slow day, some of the doctors would be like, hey, come look at this. So I highly recommend looking into that if you have an idea of what you want to go into, and if you don't, you just want to see like a day in the life kind of thing, highly recommend. So, yeah. Any other questions? Nothing else. Are you guys excited to be back at school? I know everyone's so excited, but yeah.
Other questions? Go, hurry.
Nothing. Okay, well,
Do you want to do the castle illusion thing with the
Yeah, we can.
rods and cones? Yeah, this is one of my favorites. Okay, all right. I promise it's not a jump scare. Okay. All right.
I watched it.
Okay, so if there'll be a dot that pops up in the middle here, okay, stare at the dot. Do not look away from the dot. Again, I promise it's not a jump scare. Keep your eyes on the dot. Do not look away from the dot. Keep your eyes on the dot. Because if you do keep your eyes on the dot, this picture, when it changes over, will be in color. And if you look away from the dot, it won't be. All right, still playing? Keep staring. Man, I'm staring at this a long time. Come on, keep changing. Come on, there it goes. It'll be in color until you look away, and then it'll be black and white.
Oh.
That was really.
There
was a flash of color there.
I appreciate the dedication, Sarah.
As long as you can keep, and it doesn't even have to be the dot. You just have to keep your eyes focused in the same spot the whole time. The dot just keeps it handy.
Bro, my
but if
eyes
you
were
look
watering
away and look
so
back,
bad.
it's black and white. Yeah.
Where you're looking at.
Yes, yes.
And color at the same time.
So, thank you so much for coming out and sharing with us. I'm sorry that you have to leave to
No.
go tonight, but.
I know, I'm like
Yes.
kind of procrastinating. I don't want to go. This break has been so nice.
Yes,
yes.
Thank you guys. I
Yes,
appreciate
thank
being
you.
here.
There's some cookies and juice boxes back here if you guys want some. That's clay, don't eat that, okay? And that's cardboard, also not that, don't eat that. But if you guys want to get some snackage.
For like
Don't be shy, folks, get some snacks.